So are there any questions, any comments, anything?
While
Yes.
you make your questions, even though I'm in a hospital and I show to you how we practice, the hospital has the only program in Brazil, the graduate program in cleft lip and palate and syndromes is in our hospital. So the students you see connected are my master and PhD students. So if you see different students there, and we do clinical research, educational research, and then Dr. Flores has asked about how we pass the information for patients. We also develop instructional material online. So we create classrooms, and some of my students are work on that. First, we test them with our students. Then we test them with parents. Then here we have two of my PhD students that are on computer science. So one of them is Patrick.
Hi, Patrick.
Say hi, Patrick, like that. He works with data mining. It's amazing what we can do. And then we have Vinicius. He's developing a game for us. We have a testing material that we cannot use with children or even with patients because the images, they are not, they do not belong to the context of that child. And Vinicius is developing a game. First is a memory game, and then we go into, once we evaluate the child on discrimination of minimal pairs, then when we go assess them, treat them, then he will develop games that we can use. And one interesting thing we will tell you is that when you record your patient with their speech alterations in our area here in cleft palate and velopharyngeal dysfunction, and you place their speech in pairs for they to discriminate. If their speech is marked by use of a typical place of production, sometimes they don't think, when they hear, they don't think that they are the ones talking. They don't recognize that. So we are testing that, not all of them. So we need to discriminate for speech therapy, which ones are that really know that they speak different, and which are the ones that think that they just have a variation, that they speak just like us with a little lisping. Let's make an example that I can think here. I think I took you guys too long here for an extra half an hour. I apologize for that. Let me see if there's any other student.
Eduardo is here. Eduardo.
Eduardo is a lawyer. Eduardo, say hi. Eduardo is doing an outstanding research. He's looking with healthcare professionals how they understand the impact of cleft palate or craniofacial anomalies in speech and facial appearance, and how this can be handicapping. And because we have some funding for people with handicap in Brazil, but they don't recognize patients with craniofacial anomalies under this law, so our patients cannot access. So he's working, Brazil is trying to change that, and now I'm talking about different governments, but Eduardo is working on this conception, and you guys can correct me. I saw Amanda connected earlier. Amanda,
Ana Laura's here.
Laura and Amanda are speech pathologists, and Laura works with velopharyngeal mechanism, speech therapy, and bulb reduction. And Laura is developing a material for students regarding the first 3 years. How do you get a child that has, like Lucas? that the surgery got completely wrong and you cannot repair and you cannot put a obturator. They are too little. How do you work with parents for them to develop speech but do not acquire this atypical place of production? So that's the material Amanda was working.
Yeah, I see
And
Amanda.
I cannot see, sorry, students, I cannot see you.
Gabriela Kleber.
Gabriela Prearo, who? Where?
Gabriela Aparecida Prearo.
Yes, Gabriela works with acoustics. And she went to Canada to work with Dr. Tim Brasson. And now she was hired by a craniofacial center in the southern states. And is very happy doing what she likes most. Thank you for connecting. And I cannot see them.
And they are with the
Okay.
I
I cannot see from here. For some reason, I don't see. Oh, there you are. Ana Laura, actually, Ana Laura is Amanda because she's probably in her sister's web.
Okay.
Okay.
Well, I want to thank you all.
Students of mine, if I forgot one of you, is because I'm not seeing.
Yeah, I'm the one that's looking at everybody to see who's here and who's not.
Guys, I'm very sorry that we didn't have time for interactions for you. Oh, Kleber is connected.
Kleber is here. Yes.
Kleber is a physical therapist, and he's working on a protocol for assessment of the outcome of the intensive therapy, but a broad protocol. So he's working with SLPs, of course, he's a physical therapist, the psychologist. I forgot one of the areas.
We have a multidisciplinary group on this.
Mm-hmm. And we love to have visitors. Of course, funding is difficult, but we are open. COVID is under, even though the news tell, horrible stories, if you're vaccinated, our students are back presently here. Of course, we need to be careful, but the next year, I understand we are going to be exchanging students again, bringing students and sending students and exchanging faculty also.
Well, perfect, because we have two of our partners here, Costa Rica, which is Isis and Carolina, Dr. Flores, which I have talked to her about, possibly being a partner. And of course, I think that having global experiences that provide you with a glimpse into the work that's being done, that's why it's so important. We pay a lot of attention to speech language pathology in the United States or domestically, but I really think that you widen your horizon when you start to really look at speech language pathology globally. In Brazil, I think I had spoken to Mariah one time about students that have gone to work with the Department of Defense, and they work in Germany, or they work in Guam, or they work in, so there are a lot of opportunities. So hopefully we can have those discussions at some other time. Dr. Dutka, thank you so much for being with us, all of her students.
Thank you for having me.
And by the way, Brasileño, come to Orlando. There's a lot of shopping. You know that, right?
Yes, shopping, yeah. Yes. But no hablé mi español. No falei português.
Talk to them, Jennifer, talk to them about Portugal. Talk to them about that.
My portuñol, eu conheço Linda, conozco Linda há muitos años. She is, Linda é la madrina, godmother of my youngest daughter. So see, we go 3 languages all in the same package. And there is algunas personas piensan que eso es un impedimento para el desarrollo de habla y lenguaje de niños. And I have 3 trilingual daughters, and Linda can say they speak since year 1, the 3 languages. And I no tenía, I never divided In the morning, English, in the afternoon, Spanish, in the night, Portuguese. No, we spoke like I'm speaking here, one mix of things. Of course, movies, that helped a lot. They watched the movie in English. That time, you guys don't know that, but the VHS were not like the CDs that you select the language. So I had in the 3 languages. So after they see a movie for like in English, which was their native language, let's say for 3 times, the movie in English disappeared magically. Mom, it's not this one that we want. I don't know where it is. You have to watch this one. And then they watch Spanish, 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 and then magically the Spanish disappeared. Mom, it's not this one. That's the one I found. So you watch the Portuguese, Portuguese, Portuguese. My children are trilingual with very little effort. Of course, going to Puerto Rico, going to US, polish that.
They're very multilingual and multicultural. So that is really, and I laugh because Isis speaks English, and she does sort of the same thing over there in Costa Rica. So she has worked with our students, and she is sort of the ambassador when we go to Costa Rica, and she does an excellent job. Excellent job. So thank you, all of the students. Dr. Dutka, we will talk. Isis, we will talk. Carolina, igual. And I hope, Dr. Flores, that you've had a good time and we can have some conversations about international affiliation. And students, it is 3:16. So I am asking you to take a break, come back at 3:30. So take a 15-minute break. And my guest speakers, if you want to stay on for a minute.
Thank you.
Okay. They say thank you, Dr. Dutka.
You need me to stay, Linda?
Of course I need you to stay.
Oh.
Okay, so everything was good. And Marcio, what happened to him? We didn't say thank you to him.
To the students?
Not,
I
well,
think
I always said thank you to the students.
Oh,
¿Quién
they left.
falta?
Yeah. So Kleber is there. I think
Marcio, thank you for facilitating. ¿Dónde está Marcio?
Hi, Professor.
Thank you so much. You did good.
Welcome
You
as
did
always.
really good. Okay, I'm going to stop recording.
Marcio is our